Okay, so guys, my name is Dr. Wajid Khan. We'll be dealing with this topic of eyelids. Eyelids. In eyelids, what we need to start or what we need to deal with, we need to deal with the diseases of the eyelids, such as ptosis. There is a disease called as ptosis. Okay, what is this meant by ptosis? Drooping of the upper eyelid is called as ptosis. Drooping of the upper eyelid is called as ptosis. But why is this upper eyelid drooping? What is the cause of ptosis? The most common cause of ptosis, there are many causes guys, there are many causes of ptosis. The causes being what? It could be neurogenic ptosis due to damage or due to weakening of the third cranial nerve. The patient might land up into ptosis. That is a neurogenic cause of ptosis. Then there is a myogenic cause of ptosis. Myogenic, the muscle supplying the eyelid, levator palpebrae superior, as it is getting weak, that leads to ptosis. There is neurogenic cause, there is myogenic cause, there is mechanical cause of ptosis. Mechanical meaning what? There is some tumor of the upper eyelid that is putting pressure on the upper eyelid to droop. That is a mechanical cause of ptosis. Then there is a senile cause of ptosis. As you are aging, as we are aging, our muscles are getting weak and then the upper eyelid gets droop. That is a mechanical cause. So anyways guys, ptosis is what? Drooping of the upper eyelid is called as ptosis. Coming to the first cause of ptosis, which is called as a neurogenic cause. Due to the palsy of third cranial nerve, the patient might land up into ptosis. And that neurogenic cause of ptosis is also called as Horner's syndrome. It is also called as what syndrome guys? Horner's syndrome. What is Horner's syndrome guys? What is meant by Horner's syndrome? Horner's syndrome is characterized by what? Horner's syndrome is characterized by, we used to remember, even though it's a weird mnemonic, we used to remember it as Horny Pamela. Okay? Horny is Horner's syndrome, Pamela is Pamela. P is ptosis. What are the features of Horner's syndrome? Ptosis, anhidrosis, meiosis, anophthalmos, loss of ciliospinal reflex, loss of ciliospinal reflex, and distortion in the shape of two pupils, distortion between the two pupils, that is called as anisocoria. Anisocoria. One pupil is 2 mm, other pupil is 3 mm. Distortion in the size of two pupils of the eye is called as anisocoria. So remember, these is the features of Horner's syndrome. Very, very important guys. So remember guys, ptosis, the most causes of ptosis are neurogenic, myogenic, mechanical and senile. Neurogenic cause, third cranial nerve palsy leading to Horner's syndrome, where you see Horny Pamela, that is ptosis, anhidrosis, meiosis, anophthalmos, loss of ciliospinal reflex and anisocoria. Right? Now guys, myogenic cause of ptosis. Neurogenic, we have discussed myogenic. Myogenic meaning what? The muscle that supplies the eyelid is called as LPS muscle. If that gets weak, then it leads to what? Myogenic cause of ptosis. So myasthenia gravis can cause congenital weakness. In myasthenia, remember the most common disease associated with myogenic ptosis is myasthenia gravis. In myasthenia gravis, there may be weakening of LPS muscle that can lead to ptosis. Which celebrity suffers from myasthenia gravis? Amitabh Bachchan. It's not Amitabh Bachchan. Amitabh. Right, just repeat from here. Which celebrity suffers from myasthenia gravis? Amitabh Bachchan. Okay. So anyways guys, even though the spelling of Bachchan is not right, but still just we are not concerned with the spelling of him. We are talking about this ptosis. So myogenic cause we have discussed. Senile ptosis means what? Senile means age-related ptosis. After the age of 50, there is laxity of the muscle supplying the eyelid and that leads to ptosis. That is senile ptosis. Mechanical ptosis meaning what? A tumor that is present on the eyelid, that is putting pressure on the eyelid and causing drooping of it. That is a mechanical cause of ptosis. Tumor or any mass such as chalazion and painless mass can cause ptosis. How will you manage this patient who is having ptosis? How will you manage, guys? The management of ptosis is what? If the patient is having mild to moderate ptosis, what you should do, guys? What you should do? Here you should go for levator resection. Basically, you have to strengthen the muscle, strengthen the levator muscle, right? Strengthen the levator muscle for ptosis. If there is a severe ptosis, then you have to put a sling in order to apply pressure on the, in order to give support to the levator muscle. That sling that you use is called as fascia lata. Hence, that sling that you use is fascia lata sling, right? For mild to moderate ptosis, you need to go for what? You need to go for resection of the levator muscle. Whereas for severe ptosis, you need to go for what? You need to go for applying a sling. That is called as fascia lata sling, right? Glands of Moll, guys. Glands of Moll are what? These are the modified sebaceous glands which are present between the junction of two eyelashes. Where the two eyelashes meet, there a small junction is there where you will see it. Okay? So glands of Moll are modified sebaceous glands which are present between two eyelids. So cut this point. We'll again start with glands of Moll. Where are glands of Moll present, guys? Glands of Moll are the modified sebaceous glands which are present between the two eyelids, between the junction of two eyelids. The function of this glands is what? They secrete some watery solution which will join the tear. So once again, guys, we are discussing about three glands which are present in the eyelids. One is what, guys? Meibomian gland, that is helping in the formation of meibium, right? That is helping in the formation of lipid layer. That is our modified sebaceous glands. All three are modified sebaceous. Then glands of Zeis. They are present at the base of the eyelashes. The function is to lubricate the eye. The third is glands of Moll. Inflammation of these glands leads to many diseases. What diseases, guys? Now we'll discuss those diseases. One disease is called as external hordeolum. Other disease is called as internal hordeolum. The next disease is called as chalazion. What is chalazion? Chalazion is a chronic inflammation of the Meibomian glands. Unlike the other, guys, internal hordeolum was what? Acute inflammation of the Meibomian gland where the patient is having painful swelling. Chalazion is what? Chronic inflammation of the Meibomian gland where the patient is having painless swelling of the lid margin. Painless swelling you will see on the lid margin. Treatment is what? You don't have to treat. Painless, don't treat. It will resolve spontaneously. But still, if it is not resolving, then you can give intrasteroidal injection, intralesional steroidal injection. Or sometimes you might see some cystic content develop in the chalazion. There you have to go for IND, incision and drainage. But remember, 90% of the cases of chalazion, the main management is what, guys? What is the main management in 90% of the cases of chalazion? What is the main management that we do? Come on. It is that it will resolve spontaneously. If it doesn't resolve spontaneously, what we can do is we can give an injection of steroid inside the chalazion that will shrink it. Or if you see cystic contents, you can give IND, incision and drainage. That was regarding chalazion. So guys, remember, external hordeolum of Stye is what? Inflammation of the glands of Zeis, right? Acute suppurative inflammation of the glands of Zeis where there is maximum point of tenderness on the swelling only. Treated by hot compression or antibiotics. Internal hordeolum is what? Inflammation of the Meibomian glands where the swelling is there, but you will find a bit of pain on the swelling, but maximum point of tenderness is away from the swelling. Chalazion is what? Painless swelling of the Meibomian, painless infection of the Meibomian glands. Okay. Next, there are some more disorders of the eyelids such as entropion. Entropion is what, guys? Inturning of the eyelids is called as entropion. In-turning of the lid margin is called as entropion. There are many causes, guys. There are many causes. Cicatricial is there. Cicatricial means if there is a scar forming in the lower eyelid, the eyelid might in-turn. Okay? There is senile entropion, age-related entropion, right? So anyways, guys, remember entropion is what? In-turning of the lid margin. Etiology, cause of it is what? Cicatricial meaning what? Scar forming due to burns. SJS, Stevens-Johnson syndrome, you will see burns. Okay? Due to trachoma. Trachoma also you are seeing scarring on the upper as well as sometimes on the lower eyelid. That can cause entropion. So remember, guys, entropion is in-turning of the lid margin is called as entropion. Either scar forming, cicatricial entropion can be seen either due to Stevens-Johnson syndrome, trauma, burns injury, or due to trachoma. Or senile entropion can also be seen after the age of 50. Okay? Then there is a condition called as ectropion. Ectropion meaning what? Out-turning of the lid margin is called as ectropion. Again, ectropion, age-related you might see, or paralytic. If the orbicularis oculi muscle undergoes paralysis or there is weakening of this muscle, then the eyelid might outturn. That is called as paralytic ectropion. And ectropion causes also cicatricial. So entropion and ectropion causes are almost same. In ectropion, you need to remember there is paralytic ectropion also. Okay. Last is what? Trichiasis. Trichiasis meaning what? In-turning of the eyelashes. That is a bit dangerous, guys. That we discuss in trachoma. If eyelashes in turn, they might constantly irritate the cornea or damage the cornea, leading to what? Corneal opacity. So in-turning of the eyelashes could be called as trichiasis. Now, this causes of trichiasis are basically the causes of entropion. When the eyelid in-turn, eyelashes will also in-turn. So basically, entropion can lead to trichiasis. What are the causes of trichiasis or entropion? Same causes, guys. What same causes, guys? Come on, what same causes? Scarring due to cicatricial entropion due to scarring. Scarring that can be seen due to Stevens-Johnson syndrome, trauma, or trachoma. And there is senile. Okay? So these are the causes. Whenever there is in-turning of the eyelashes, this is very dangerous. Why? Because trichiasis can cause corneal opacity. Trichiasis can cause corneal opacity. And how will you manage trichiasis? If there is in-turning of the eyelashes, just you plug the eyelashes out. The management of trichiasis is epilation. Management is what, guys? Epilation. That's regarding what? That's regarding trichiasis and eyelids. Okay, guys, thank you.